Sacroiliac joint pain. Pain arising from the sacroiliac joint is one of the potential causes of axial low back pain. A physical examination will help determine whether the sacroiliac joint is the source of your pain. The doctor will feel around the pelvis, lower back and sacrum to find exactly where it is most painful. He will feel for tenderness over the joint below the waist where two dimples are visible. Legs length should also be measured. After that, the doctor will complete a series of specific clinical tests. Numerous sacroiliac joint provocation stress tests are available. Unfortunately, there is no single test that is both sensitive and specific in identifying sacroiliac joint dysfunction. A few of these maneuvers are Patrick's or Faber's test, flexion, abduction, and external rotation. The patient lies supine on the exam table. Flex and externally rotate the hip and knee of one leg to rest the lateral malleolus just proximal to the contralateral patella. Pain in the sacroiliac joint region is considered positive for sacroiliac joint dysfunction. Pain in the hip or groin suggests hip pathology. Ganslin's test. The patient lies supine on the exam table. Flex the contralateral hip and knee towards the patient's chest while the opposite leg is allowed to drop off the table's side. Pain in the sacroiliac joint region of the lowered leg suggests sacroiliac joint dysfunction. This test may also be performed with the patient lying on the side. Sacroiliac joint distraction test. The patient lies supine on the exam table. The examiner applies an oblique load, downward and laterally on both the anterior superior iliac spines. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. Thigh thrust. The patient lies supine on the exam table. The examiner flexes the hip and knee on one side till the thigh is vertical to the exam table. The examiner wraps an arm around the flexed thigh and knee and places one hand under the sacrum, then he applies a downward load through the femur. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. Lateral compression test. The patient lies on his side. A downward directed compression force is applied with the heel of the hand to the iliac crest on the top. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. Sacral thrust test. The patient lies prone on the exam table. A downward directed force is applied with the heel of the examiner's hand centrally over the sacrum. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. The presence of 3 or more of the provocative tests will increase diagnostic accuracy. X-rays can diagnose, exclude some bone pathologies such as fractures and osteoarthritis. MRI may show signs of sacroiliac joint inflammation or other possible sources of pain, especially within the lower back, pelvis and hip complex. Image-guided injections are the gold standard to confirm the diagnosis of sacroiliac joint pain. An injection of steroid and anesthetic into the sacroiliac joint can be used as both a diagnostic test and also treatment. The injection is given using X-ray fluoroscopy to ensure accurate needle placement in the joint. The pain level is evaluated before and 20 to 30 minutes after injection and monitored over the next week. Sacroiliac joint involvement is confirmed if your pain level decreases by more than 75%. If your pain level does not change after the injection, it is unlikely that the sacroiliac joint is the cause of your low back pain.